I want to talk to you today about something that happens to a great many older adults, something that can feel like a brief moment of dizziness or unsteadiness when you stand up, and that most people brush off as nothing, but that genuinely deserves your attention, because it's both a real warning sign and a real risk for one of the most dangerous events in later life: a fall. I'm talking about what happens when you stand up too quickly. You rise from your bed in the morning or push up out of your armchair, and for a few seconds the room swims. You feel lightheaded. Maybe your vision dims or grays at the edges. You feel unsteady, and you have to grab something or pause until it passes. Doctors call this orthostatic hypotension, which simply means a drop in blood pressure when you stand up. And while it can feel like a minor, passing thing, it's worth understanding, because that brief moment of dizziness is your brain being momentarily starved of blood. And the unsteadiness it causes is a genuine cause of dangerous falls in older adults. So, today I want to explain what's actually happening, why it becomes more common as we age, what causes it, why it matters, and exactly what to do about it, including the simple change to how you stand up that can make a real difference. And I'll keep this calm and practical, because while this is worth taking seriously, it's very manageable. Let me start with what's actually happening in your body, because understanding it makes everything else make sense. And it's genuinely interesting. Gravity is constantly pulling your blood downward, toward your feet. When you're lying down or sitting, that's not much of an issue, because your body is roughly level. But the moment you stand up, gravity pulls a significant amount of your blood down into your legs and lower body, away from your upper body and your brain. Now, in a healthy system, your body responds to this instantly and automatically. Sensors in your blood vessels detect the change, and within a second or two, your body tightens the blood vessels in your lower body and slightly speeds your heart, pushing blood back up and keeping a steady supply flowing to your brain so you don't even notice. This rapid adjustment is called the baroreflex, your body's automatic blood pressure balancing system. But here's the problem. When that adjustment is too slow or too weak, the blood doesn't get pushed back up to your brain quickly enough when you stand. So for a few seconds, your blood pressure drops and your brain is briefly short of blood and oxygen. And that brief shortage of blood to the brain is exactly what causes the dizziness, the lightheadedness, the graying or dimming of vision, and the unsteadiness you feel. So, the dramatic phrase about your brain being starved of blood has a real kernel of truth. When you stand too fast and your body can't compensate quickly enough, your brain really is, for a few seconds, getting less blood than it needs, and your body is signaling that with dizziness. So, let me explain why this becomes more common as we age, because that's the heart of why it matters in later life. As we get older, that automatic baroreflex, the system that adjusts your blood pressure when you change position, becomes slower and less responsive. The blood vessels become stiffer and less able to tighten quickly, and the whole adjustment is sluggish, so the drop in blood pressure on standing is larger and lasts longer before the body corrects it. On top of that, several other age-related and common factors make it worse. Older adults are often somewhat dehydrated because the thirst signal fades with age, and lower fluid volume means lower blood pressure and a bigger drop on standing. Many older adults take medications that lower blood pressure or affect fluid balance, which I'll come to, and these substantially increase the tendency. And certain conditions common in later life affect the nerves and the system that controls blood pressure. So, the aging body is both slower to compensate for the gravity effect and more likely to have the contributing factors: dehydration, medications, conditions, which is exactly why standing up dizziness becomes so much more common as we age. It's not just clumsiness or being out of sorts. It's a real physiological change in how well the body manages blood pressure with position. Let me go through the causes and contributors in a bit more detail, because knowing them points to what can be addressed. First, as I said, the natural age-related slowing of the baroreflex. Second, dehydration, which is common and very fixable, and which lowers blood volume and worsens the drop. Third, and very importantly, medications. A number of common medications cause or worsen orthostatic hypotension, including blood pressure medications, especially water pills or diuretics, which reduce fluid volume, some heart medications, certain medications for an enlarged prostate, some antidepressants and medications for the nerves, and medications that affect the circulation. Because older adults often take several of these, medications are one of the leading contributors, and crucially, this is often adjustable, which is why a medication review with the doctor matters. Fourth, certain medical conditions affect the nerves that control blood pressure, including diabetes, which over time can damage those nerves, and Parkinson's disease and some related conditions, which commonly affect blood pressure control. Fifth, prolonged bed rest or inactivity deconditions the system and worsens it, which is why people are often dizzy on standing after an illness or hospital stay. Sixth, having just eaten a large meal can cause a related drop in blood pressure because blood is diverted to the digestive system, so some older adults feel dizzy after meals, and alcohol and being overheated can contribute. So, the contributors are the natural aging of the reflex plus dehydration, medications, certain conditions, inactivity, large meals, and more, several of which are very addressable. Let me describe the symptoms clearly because recognizing them is the first step. The classic experience is feeling dizzy, lightheaded, or faint when you stand up, especially from lying or sitting, and especially first thing in the morning when you get out of bed, after sitting for a long time, or after a meal. You might feel the room spin or sway, your vision might blur, dim, gray out, or briefly go dark at the edges. You might feel unsteady or weak in the legs, and occasionally people feel a brief confusion or a headache. The symptoms typically come on within seconds of standing in ease within a short time as your body catches up and restores the blood flow to your brain, often within a minute or so if you pause. In more significant cases, the drop can be enough to cause an actual faint, a brief loss of consciousness, which is obviously more serious. So, the pattern to recognize is dizziness, lightheadedness, visual dimming, or unsteadiness that comes on when you stand up and eases when you pause or sit back down. That pattern, tied specifically to standing or changing position, is the signature of orthostatic hypotension, and it's worth noting and mentioning to your doctor, especially if it happens often. Now, let me be clear about why this matters so much, because it's not really the brief dizziness itself that's the danger. It's what it can lead to: falls. As I've discussed before, falls are one of the gravest threats to an older person's health and independence because aging bones are fragile. A fall can cause a broken hip or a head injury, and the consequences can be life-changing or worse. And orthostatic hypotension, that moment of dizziness and unsteadiness on standing, is a genuine and common cause of falls in older adults. You stand up, the room swims, your legs feel unsteady, and you lose your balance and fall, sometimes before you can grab anything. So, the real danger of standing up too fast isn't the unpleasant dizzy feeling. It's that the dizziness and unsteadiness can pitch you into a dangerous fall. That's exactly why this deserves to be taken seriously and addressed, not because the brief lightheadedness is itself harmful, but because preventing it helps prevent falls, and preventing falls protects your independence and your life. So, when I urge you to take this seriously, it's the fall risk I have most in mind. So, let me get to the practical solution, starting with the single most important and simplest change: rise slowly, in stages. This is the key behavioral fix, and it works by giving your body the time it needs to make that blood pressure adjustment. Instead of springing up from lying or sitting, do it gradually. When getting out of bed in the morning, which is the highest risk moment because you've been lying down for hours, don't sit bolt upright and stand immediately. Instead, sit up slowly, then sit on the edge of the bed for a minute or so, letting your body adjust, perhaps gently pumping your feet and ankles to help push blood upward, and only then stand up, pausing a moment once you're upright before you start walking, with something sturdy nearby to steady yourself. The same applies to rising from a chair. Don't leap up, rise slowly, pause, and steady yourself before walking. This staged approach, lie to sit, pause, sit to stand, pause, gives your sluggish baro reflex the extra seconds it needs to push blood back up to your brain, so the dizziness is reduced or avoided. It costs nothing. It takes only a few extra seconds, and it's genuinely one of the most effective things you can do to prevent both the dizziness and the falls it causes. So if you take away one action, let it be this: stand up slowly, in stages, especially when getting out of bed. Let me give you the other practical measures because several things help. First, stay well hydrated, drinking enough fluid through the day even without thirst, because dehydration worsens the blood pressure drop, and adequate fluid is one of the simplest protective measures. Second, review your medications with your doctor because, as I said, many medications cause or worsen this, and your doctor may be able to adjust the dose, change the timing, or switch a medication to reduce the problem, though as always, you should never stop anything on your own. Third, be aware of the high-risk moments and take extra care then. Getting up in the morning, getting up at night to use the bathroom, standing after a long sit, and standing after a large meal, and rise especially slowly at those times. Fourth, if you get dizzy after meals, eating smaller, more frequent meals can help. Fifth, certain measures your doctor might recommend can help in some cases, like compression stockings, to reduce blood pooling in the legs, raising the head of the bed, or specific advice tailored to you. Sixth, avoid things that worsen it, like getting overheated, hot baths that dilate the vessels, alcohol, and prolonged standing still. And seventh, stay generally active and avoid prolonged bed rest because conditioning helps the system work better. Together, these measures, led by rising slowly and staying hydrated, substantially reduce both the dizziness and the fall risk. Now, let me be clear about when this warrants seeing your doctor, and when it's more urgent, because while orthostatic hypotension is common and often manageable, it deserves proper attention. See your doctor about dizziness on standing if it's happening regularly, if it's troubling you, if it's affecting your daily life, or if you've had any falls or near falls because your doctor can confirm what's going on, often simply by measuring your blood pressure lying down and then standing to see the drop. Review your medications, check for contributing conditions and dehydration, and guide you on managing it. And there are situations that warrant prompt or urgent attention. If you actually faint or lose consciousness, if the dizziness comes with chest pain, palpitations, severe headache, slurred speech, weakness on one side, confusion, or other neurological symptoms, because those could signal a heart or brain problem rather than simple orthostatic hypotension, or if it comes on suddenly and severely. So, the framework is regular or troubling standing up dizziness, or any related falls, warrants a calm visit to your doctor to address it, while fainting or dizziness with chest pain, palpitations, or neurological symptoms warrants urgent care. Most of the time, it's the manageable orthostatic kind, but those red flags are worth knowing. Let me paint you a picture of how this commonly plays out, because it shows the risk and the simple fix. Picture a man in his 70s who, every morning, swings his legs out of bed and stands straight up to head to the bathroom, and most mornings feels a brief swim of dizziness that he's learned to just push through. He takes a blood pressure medication and a water pill, and he doesn't drink much in the evening or overnight. One morning, he stands up fast, the room grays out, his legs go unsteady, and before he can grab anything, he loses his balance and falls, fracturing his hip, with all the long, hard consequences that follow. The brief dizziness he'd been brushing off for months was the warning, and standing up too fast was the trigger. Now picture the same man who understands what you now understand. He learns to rise in stages, sitting on the edge of the bed for a minute, pumping his ankles, then standing slowly and pausing before he walks. He makes sure to drink enough fluid, and he mentions the morning dizziness to his doctor, who reviews his medications and adjusts the timing of his water pill. The dizziness largely resolves, and the dangerous fall simply never happens. Same man, same medications, but understanding the cause and changing how he stands up protected him from a life-changing fall. That's exactly the difference this knowledge can make. And let me speak directly to those of you caring for or close to an older person, because this is a common, addressable contributor to falls, and you can help. You might notice a loved one becoming unsteady or grabbing for support when they stand, complaining of dizziness on getting up, or having had falls or near falls, especially in the morning or when rising from a chair. You can help by encouraging the staged, slow way of standing up, especially when getting out of bed, and by reminding them to pause and steady themselves. You might even practice it together. You can make sure they stay well hydrated. You can help arrange a medication review with their doctor, since medications are such a common contributor, and a simple lying and standing blood pressure check can confirm the problem. You can make the high-risk moments safer, ensuring there's something sturdy to hold near the bed and the chair, good lighting, and a clear path for nighttime bathroom trips, and so on, tying into the broader fall prevention measures. And you should know the urgent signs, fainting or dizziness with chest pain, palpitations, or neurological symptoms that warrant prompt medical care. Helping a loved one recognize and manage standing up dizziness, and especially helping them build the habit of rising slowly, can prevent a dangerous fall and protect their independence. Let me draw this all together. When you stand up, gravity pulls blood down toward your legs, and your body normally compensates instantly to keep blood flowing to your brain. But when that compensation, the barrow reflex, is too slow or weak, your blood pressure drops on standing, and your brain is briefly short of blood, causing the dizziness, lightheadedness, visual dimming, and unsteadiness of orthostatic hypotension. This becomes much more common with age, because the reflex slows, the vessels stiffen, and contributing factors pile up: dehydration from fading thirst, the many medications that lower blood pressure or fluid, conditions like diabetes and Parkinson's, inactivity, and large meals. The real danger isn't the brief dizziness itself, but the falls it can cause, which are so serious in later life. And the good news is that it's very manageable, above all by rising slowly in stages, especially when getting out of bed, giving your body time to adjust, by staying well hydrated, by reviewing medications with your doctor, and by taking care at high-risk moments. A doctor can confirm it with a simple lying and standing blood pressure check and help manage it, while fainting or dizziness with chest pain, palpitations, or neurological symptoms warrants urgent care. So, here's what I'll leave you with. First, understand that dizziness on standing is your brain being briefly short of blood because your body didn't adjust your blood pressure quickly enough, that this becomes common with age, and that its real danger is the falls it can cause. Second, make the single most important change. Rise slowly, in stages, especially getting out of bed. Sit up slowly. Sit on the edge of the bed for a minute, pumping your ankles. Then stand slowly and pause before walking with something sturdy to hold. Third, stay well hydrated, drinking enough fluid through the day even without thirst, because dehydration worsens the drop. Fourth, review your medications with your doctor, since many cause or worsen this, and can often be adjusted and never stop anything on your own. Fifth, take extra care at the high-risk moments, getting up in the morning or at night, after long sitting, and after large meals, and see your doctor if the dizziness is regular, troubling, or has caused falls, while seeking urgent care for fainting or dizziness with chest pain, palpitations, or neurological symptoms. That brief swim of dizziness when you stand up is worth heeding, not because the feeling itself is harmful, but because addressing it protects you from a dangerous fall. So, take care of yourself, stand up slowly and in stages, stay hydrated, and get it checked if it's troubling you. And because the cause needs a doctor to confirm and manage, and because medication adjustments must be made with your physician, please treat regular or troubling standing up dizziness as your reason to see your own doctor, rather than as a substitute for that visit, and seek urgent care for the red flag symptoms.